Welcome to another Doctors Express Medical Minute.
I'm Dr. Thomas Brown, Medical Director for Doctors Express Urgent Care. Today's topic is Ebola virus. Unfortunately, it's been in the news recently. There's a big outbreak in West Africa. Sierra Leone and Liberia are two of the main countries that have this infection, although other countries are involved. It's a dangerous infection. It has a high mortality rate. Upwards of 50 to 90% of people who have the infection unfortunately succumb to it and pass away. In terms of typical viruses, it's not terribly contagious. The way you get it is by exposure to bodily fluids, whether it's saliva or sweat. So the symptoms initially in the first few days are like a lot of viral infections: fatigue, headache, fever. After exposure, anywhere from 2 to 21 days, a person may develop the symptoms. Although most of the time, between 8 and 10 or 12 days is when people classically develop the symptoms. The symptoms, as I said, headache, fever, fatigue, but also diarrhea, stomach pain, and severe muscle aches. The fever can often be very high as well. We actually call this a hemorrhagic fever, very high fever with excessive bleeding. And the bleeding, in fact, is actually usually what causes a person to pass away. They go into what we call shock in medicine. Healthcare workers, family members around infected individuals who are exposed are at risk. So you have to use proper barrier precautions, face mask, gloves, those sort of things. Unfortunately, in Africa, those are not readily available, and that's part of the reason. Another part of the reason why folks have it in Africa is in part due to some of the rituals before burial. The family members may wash the body of the deceased. It's a sign of respect, but of course they can be exposed to bodily fluids during that rite. So anything's possible, but we're very fortunate in the United States. CDC, Centers for Disease Control, is watching this whole scenario play out very closely. We've taken all appropriate precautions to prevent an outbreak in the United States. People have good access to health care. They can wash their hands. We have sewer systems. We have systems in place to sort of ensure that this doesn't occur in this country. As of the time of this taping, we haven't had any infected patients in the United States. We've actually brought, I think it's 4 now, infected healthcare workers back to the United States to take care of them, but we haven't actually had an infection here. We're working on a vaccine and we're working on a treatment that both show great promise. I won't get into the details, but they're still several years away from being mainstream, being available. So they're investigational at this point. So unfortunately, the treatment right now is supportive. Intravenous fluids, if it looks like they have an infection, antibiotics, supportive care.
This has been another Medical Minute from Doctors Express Urgent Care, with locations in Danbury, West Hartford, Bridgeport, Stamford, and Hartsdale, New York.